Welcome to A to Z of Palliative Care.
Hello, doctor. Hello, viewers. In our videos, we have seen we have discussed a lot of topics. Today, I'm going to ask something to our doctor, a special question for you. Sometimes I wondered, how do you plan your work? What do you do when you go to the hospital? Do you know everything that you're going to do in advance, or anything that comes to you, you'll take it up? How do you plan it? If you could tell us about that, please.
That's an interesting and a very good question, I'd say. So, in my job role, I mainly cover community. So, when I say community, is about visiting people's home. That's the main part of the job I do. Nearly maybe 95% of my job, I do that. I visit people's home to look after them and whatever we can do to help them to make them comfortable. In this one, it's very difficult to plan well ahead actually, because sometimes you've got to visit. Let's say my work starts at 8:30, and then 8:30 to 9 we will have a meeting first of all to see what has happened the previous night. Did we get any call from any patients, and then who needs an urgent care, who needs a regular follow-up, or anybody needs to go and visit them? Do we need to talk to them over the phone? So those kind of things we will get first information in that meeting, 8:30 to 9. Then from 9 o'clock, we will plan the day depending upon the urgency and the need and available like medical team, like doctors. We need to see which patient needs seeing today, which patient needs a phone call today, and a follow-up, and all those things. So literally, not every day I know what I'm going to do. Most of the days, I don't know what my work is going to be on that particular day. Only at 9 o'clock, I will know. And then you can plan accordingly.
Okay, so as you say, you're not aware, you go there and you find out, and after the discussion, you will get to know. And supposing, do you go and visit them, or you give them some advice over phone? What's the procedure? What do you do there?
Yeah, I do both. As I said, depending upon the urgency and depending upon the need, first of all. If somebody needs seeing urgently, there's only way we have to go out and see them. Say, let's say, for example, somebody is in pain and then they tried all the medications overnight. The pain doesn't work, and we need to discuss about getting stronger medications. Then we have to visit them. Or let's say some new problems come up. So already we know what the problem is, and suddenly a new problem come up overnight.
How does it work? How do you plan? How do you go, first of all? Um, how long does it take? You're aware of all that, or you take it as it goes? Could you please share some more inputs on that, please?
Yeah, as I said earlier, it's we don't know. Sometimes we can't plan the day well ahead. We need to do it then and there. And depending
Oh,
upon the need of a particular patient, visits can be anywhere. Yeah, I cover a large area in the place where I work with. And for example, if I translate that to Chennai, they translated the area in Chennai. So first visit might be in Adayar, second visit might be in Ambattur. So you can't say, I want to visit first in Ambattur and I want a second visit in Ambattur as well. You can't say that. So it all depends upon the need. But you rightly mentioned about the travel. We have to travel, or I have to travel a lot in my workplace because that's my main part of the job. And we need to plan. So, as much as we can, we need to plan accordingly, and we need to consider the travel time as well, because so many patients you can do in a certain time because of the travel. You need to consider that time and then go and visit and have an assessment and do support whatever they need. And you go to the next patient and then you come back to your place of work.
so even there, you wouldn't be sure. It might be one or two. Depending on that, you adjust your timings. Is it something like this? There's somebody who needs immediate attention. There's somebody whom you can see after the first one. Is it something like that?
Yeah, exactly. As I said, it's mainly based on the urgency and the need. If somebody needs seeing within an hour, we will go. And sometimes, let's say I booked a visit at 9 o'clock, and then you need an urgent visit. Let's say the follow up visit was at 9 o'clock in the morning, and you have some urgent situation you have to go. Then we ring the patient we booked at 9 o'clock and request them, can we see you at 10? So I've got another visit urgently. And that's how we plan. And people are very flexible because they know here somebody needs more attention than me. And then they will understand. And they are flexible in terms of timings. Then we'll go and visit the other patient, urgent visits, and sort out their problems, support them, try to make them comfortable as much as possible, and then go to the next visit. So it's arbitrary. We can't plan anything at all. It's just like what I said, you don't know where you're going to go. And there's a little bit of uncertainty in terms of planning. But when you learn how to manage your time, that'll become a practice. We don't get like a panic or tensed on getting into different patients at different places. It comes with experience.
That shows your experience too. Wonderful. Is there anything else that you would like to add on when you go for a home visit? What do you do there? What kind of care, attention, or how well you prepare that and deliver your service?
The preparation, most of the time, you may get information about people, what is their problem, and what is the need. Most of the time, you get. But sometimes you don't know anything because I have done this before. In a sense, I've been with patient number one, and I get a call urgently to say there's another patient close by needs urgent care. Can you go and visit? In that case, we don't know anything about that patient, not in full detail. So you just, between the patients, you just see the details and then get information from the referrer, what is about that particular patient, what are the needs, and then you clearly put your bet on your clinical judgment. You go there, assess the situation, assess the needs, and then do the management, whatever we can do. So this I am telling because it's mainly clinical. Because when people say they don't want to go anywhere from their home to the hospital or a specialist unit, hospice we call here, and if they want to be at home, it's purely clinical. Because literally, you can't do any scans, you can't do any x-rays and things, and you can't do any blood tests. When I say you can't, it is possible, but there won't be any need. And that's what people say. Don't take any bloods. Enough. Don't take any bloods. Make me comfortable. Don't worry about anything. Sometimes people say, unfortunately, I know I'm deteriorating, but don't put me through the cycle of going to hospital and bloods and things. So in those cases, without blood tests, without x-rays, without scans, the clinician, let's say me, need to assess everything based on the clinical decision. And we need to be very strong in managing people clinically. Because if we say, let's say I go and visit a patient and then say, okay, you need to go to hospital to do this test. It is possible, but if patient says I don't want to, then you've got limited information. We need to manage with the limited information with our clinical skills to do what the best we can for that particular patient.
You're very so thoughtful, and that comes by experience. That's really an important quality when you have several years of experience. Wonderful to hear that.
Right, I can add something to this, like in the community and home visits. So when I was in Chennai, just graduated at the time, I can say it was in 1998. So it sounds like a previous Janma, but it's 1998 only. So I do visit people's home wherever they are, all over Chennai. Because that time I had my bike, Hero Honda, and then just a mobile phone. So people call me anywhere, right and left, all over Chennai. One end Tambaram, the other end Adayar. So I was doing this, visiting people, and then offer what I can do at the time. But I can see just the same extension doing at a specialist level with 25 years of clinical experience in this country.
Nakash. Yes, that sounds. This has taken you to those days. That is quite interesting to hear as well. Any special you might have visited many people. Could you please tell one particular experience where you had to showcase or think about or act quickly uh, mm, related to your experience in order to get the patient well?
There are many, 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 many.
Something that you remember, something that you cannot forget.
Yeah, I would say there are many. See, when you say like quick acting, see, when we talk about people, as I said, we don't know until you go there in what situation a patient is and what situation a family is. Sometimes we see people in the very end stage. See, when I say very end stage, unfortunately, in the last few hours of their life. And when you go there, you see them, and you know very well on assessment they're not going to last longer. So in those situations, you need to be acting very, very quickly to make them comfortable and then inform the family. So this will happen, I would say, at least 3 or 4 times a week to us, because sudden deterioration can happen. See, this is what we always say, sudden deterioration can happen, but there's a difference between seeing in print, saying, and then it's happening really. So in those situations, we need to act very quickly to make them comfortable and then relay the information to family in a sensitive way and empathetic way. And in those situations, we have a very good team here to support us. So even though I said as a doctor, as a specialist, I visit patients, we need to do something more, means there are nurses available in the team. There are specialist nurses available in the team, so they can do an urgent response or rapid response team there, so they can jump in and we make everything right. So what we call these managing people in the last days or unfortunately last hours of life, there is only one chance to get it right. Because if you miss to do some things, there is no another chance. Because people generally put weightage to urgent care, acute care, and generally people think, no, that's only people deteriorating and end of life and keeping comfortable. I would say no. People in the last days of their life needs equal urgent attention and care as we do for all of them generally in accident and emergencies. So we need to treat same as the other situations. And I would like to stress the point again, there is only one chance to get it right.
Yes, so you act very quickly, very proactive approach, and if you need your team, they could come to help you. All that you decide, and you see to it that you give the best to the patient so that everything goes smooth and comfortable.
Yes, you're right. Thank you.
Thank you, doctor. Thank you, viewers.